Excellent question. So, the treatment of pulmonary embolism has to be in the hospital. You can't treat it at home. You can't treat it at a primary care facility. It has to be a hospital. Okay. Now, depending on how the hemodynamic parameters, as in the blood pressure, respiratory rate, oxygen levels, overall condition of the patient, we decide whether we can use a very strong agent to dissolve the blood clot, or should we give them agents which can potentially reduce the blood clot formation. So again, number one treatment would be thrombolysis. Thrombolysis means thrombus needs to cut, dissolve, right? So thrombolysis. The other, as I said, for thrombolysis, the people usually are very unstable. Unstable as in blood pressures all over the place, oxygen requirements all over the place. They might be not fully arousable. So it's a very life-threatening condition. We're talking about the pulmonary embolism being this symptomatic because it's going to affect your heart, it's going to affect your lungs, it's going to affect your blood pressures, it's going to affect your blood circulation, your kidneys, your brain, everything. So if that's the case, thrombolysis and maybe admission in the critical care. But the most, what to say, the most amount of people, they have pulmonary embolism, which is not that symptomatic. So we usually start them on a medication which we call as enoxaparin. It's a sort of heparin. We give those injections in the tummy and basically make them better, send them home, and they continue the medications depending on further investigation with the hematology department, and also if it was provoked or unprovoked. So all of these conditions like the DVT and the P, if we're talking, there's another factor to it if we call as provoked, and unprovoked, we don't know why it happened. Provoked, again, they were on hormonal replacement therapy, they had cancer and had risk factors precipitating to it. Someone flew a 12-hour flight